I am so excited that we have a panel focusing purely on families today. This is a huge of huge importance because families are so affected by substance abuse, and personally, I don't think we talk about it nearly enough. Those who have had a loved one with a substance abuse disorder know that addiction can be like a bomb going off inside a family. Everyone is affected. Except instead of calling 911 for help, too often the first response is to panic, to cover it up, to pray that it's a phase. Too often it isn't clear who to call for really good, reliable, effective help. Unlike with other diseases, this isn't one that most people feel comfortable about talking with the neighbors or posting on Facebook to get advice about the best experts to talk to. Children of addicts are afraid to bring friends over to their house. Parents of addicts are reticent to tell their friends the truth about what's going on for fear that their child will be shunned or they as parents will be judged. Siblings of addicts tend to get overlooked and overshadowed in the wake of the chaos at home. And babies born to addicted mothers start off their life in crisis. And unlike other diseases, there are too few public health resources. Doctors don't learn enough about addiction in medical school, if they learn anything about it in medical school. There's no race for a cure or urgency to donate to bolster research for a vaccine or treatment. Yet this problem is widespread. As others have mentioned, we all know someone who's been affected in our personal lives, our professional lives, our families. 1.3 million teens between 12 and 17 meet the DSM criteria for substance abuse or dependence. 6 million young adults between 18 and 25 do as well. That means there are roughly, at this moment, 14 million parents who are struggling to find help for their child. That's a huge number. NISDA tells us that there are 8.3 million children under the age of 18 who are living with at least one substance abusing or substance dependent parent. And as Congressman Clark described earlier, there are far too many babies being born each year with neonatal abstinence syndrome. The Partnership for Drug-Free Kids has been working hard to fill some of these gaps for families, to take addiction out of the shadows and to help people understand that they can come to us for help. Our mission is to reduce adolescent substance abuse by supporting families and engaging with teens. And we have a wide range of programs to do that. And we are, as our tagline says, where families find answers. We have a lot more resources that we can create and that we're working to create, but we're really proud of the ones that we have, including a toll-free helpline for parents, guides about how to intervene when a loved one has a problem, and help for parents looking to find assistance for a child in crisis. The partnership is really lucky to have a number of allies and partners in our work, including the women on our panel today. First, we have Karen Moyer, who is co-founder of the Moyer Foundation along with her husband, Jamie. Since its inception in 2000, the Moyer Foundation has raised more than $26 million for programs to directly serve children in need. The foundation supports a wide range of programs, including camps like Camp Mariposa, the first of its kind to help children living with addiction in their families, which is just so important, and I can't think of a worthier effort. We also have Sharon Lagore, who is founder and president of Moms Tell, a parent advocacy organization she formed after the drug overdose death of her 18-year-old daughter, Angela. She has been a tireless advocate in her home state of Pennsylvania and helped to pass legislation to create the first statewide parent advisory council for substance use disorders. She's a consultant to SAMHSA, a co-director of the National Family Dialogue for youth with substance use disorders, and she is an enormous help to the partnership, where she serves on our parent advisory board and also serves as a parent coach to families around the country. So with that, I will turn it over to Karen.